Welcome to another lesson as we cover neurologic diagnostic procedures. Cerebral angiography. The purpose of a cerebral angiography is to provide visualization of the cerebral blood vessels. How it works is that digital subtraction angiography hides the bones and tissues from the images, providing X-rays with only the vessels apparent. Defects, narrowing, or obstruction of arteries or blood vessels in the brain are detected. Important to note is that iodine-based contrast dye is injected into an artery during the procedure. There are many reasons why a cerebral angiography is used. It is used to assess the blood flow to and within the brain, identify aneurysms, and define the vascularity of tumors, useful for surgical planning. It is also used therapeutically to inject medications that treat blood clots or to administer chemotherapy. Important key points to know. Pre-procedure. If the client is pregnant, a determination of the risks to the fetus versus the benefits of the information obtained by this procedure should be made. Nursing interventions. Instruct the client to refrain from consuming food or fluids for 4 to 6 hours prior to the procedure. Assess for a history of allergies. Any history of bleeding or taking anticoagulant medication requires additional considerations and additional monitoring to ensure clotting after the procedure. Assess BUN and blood creatinine to determine the kidney's ability to excrete the dye. Ensure that the client is not wearing any jewelry. A mild sedative for relaxation is occasionally administered prior to and during the procedure, and vital signs are continuously monitored during the procedure. Client education. The head will be immobilized during the procedure, and it is important to remain still. Void immediately prior to the procedure. Following dye injection, it is common to experience a metallic taste and feel a sensation of warmth behind the eyes and over the face, jaw, tongue, and lips. Intra procedure. The client is placed on a radiography table where the client's head is secured. A catheter is placed into an artery, usually in the groin or the neck. Dye is injected and X-ray pictures are taken. Once all the pictures are taken, the catheter is removed and an arterial closure device is used, or pressure is held over the artery to control bleeding by thrombus formation sealing the artery. Post-procedure. Nursing interventions. Closely monitor the area to ensure that clotting occurs. Movements are restricted depending on the type of procedure used to seal the artery to prevent rebleeding at the catheter site. Place an ice pack on the insertion site. Complications. There is a risk for bleeding or hematoma formation at the entry site. Nursing interventions. Check the insertion site frequently. Check the affected extremity distal to the puncture site for adequate circulation, color, temperature, pulses, capillary refill. If bleeding occurs, apply pressure over the artery and notify the provider. That ends the lesson on neurologic diagnostic procedures. Check out our other nursing videos to help make studying easier. Also, see below for useful links that take you to NCLEX style quizzes, nursing study guides, and more.